Welcome to Lesson 4 of our DSM-5-TR series. In this lesson, we will explore autism spectrum disorder, one of the most important neurodevelopmental conditions in psychology and mental health. Autism spectrum disorder, often called ASD, is a complex condition that affects how a person communicates, interacts socially, and behaves. It begins early in childhood and continues throughout life, though the way it looks can change as a person grows. The word spectrum is important. It means that autism is not the same for everyone. It varies widely from person to person. Some individuals may need significant support in their daily lives, while others may live independently but still face challenges in social communication or behavior. The common thread is that autism always involves difficulties in social communication and interaction, along with patterns of restricted and repetitive behaviors or interests. To diagnose autism, certain core features must be present. The first is persistent difficulties in social communication and social interaction across multiple settings. People with autism may struggle with the natural back and forth of social conversation. A child, for example, may not respond when someone calls their name or may not initiate play or share emotions the way other children do. They may also have difficulty using nonverbal communication such as eye contact, gestures, or facial expressions. Many individuals with autism struggle to develop and maintain relationships. They might not know how to adjust their behavior to different social situations, may not share imaginative play, or may show little interest in peers. The second major part of diagnosis involves restricted or repetitive patterns of behavior, interests, or activities. These behaviors might include repetitive movements like hand flapping or rocking, repetitive use of objects like lining up toys, or repetitive speech such as repeating phrases. Many individuals prefer routines and become distressed when routines change. Some may develop intense interests, focusing deeply on topics or objects that might seem unusual in their intensity. Others show unusual responses to sensory input. They might be highly sensitive to certain sounds, textures, or lights, or they might seek out specific sensory experiences like watching spinning objects. These symptoms must appear in early development, though they might not become obvious until social demands increase beyond the child's abilities. They also must cause significant challenges in daily life, affecting relationships, school, work, or other areas of functioning. Importantly, autism is not explained solely by intellectual disability. While autism and intellectual disability can occur together, autism involves social communication skills that are lower than expected based on overall development. Autism is described using severity levels, which help communicate how much support a person needs. Level 1 means the person requires support. They may speak in full sentences but struggle with back and forth conversation and adapting to changes. Level 2 means substantial support is required. These individuals may speak in simple sentences, have limited social interactions, and show restricted behaviors that are noticeable to others. Level 3 means very substantial support is needed. These individuals often have minimal speech, severe social communication challenges, and intense repetitive behaviors that significantly affect daily life. Severity can change over time and differs depending on the environment and support available. Clinicians also use specifiers to describe autism more precisely. These include whether the individual has or does not have intellectual impairment, whether they have or do not have language impairment, and whether the condition is associated with another medical, genetic, or environmental factor. Catatonia, a condition that involves unusual movement patterns or immobility, can also be noted if present. Autism often occurs with other features. Some individuals have language delays or intellectual impairment, though these are not always present. Motor difficulties such as clumsiness or unusual gait are common. Some individuals may engage in self-injurious behaviors such as headbanging or biting. Sensory differences are also frequent, with individuals reacting strongly to certain sounds or textures or seeking sensory experiences. Emotional regulation can be difficult, leading to meltdowns or intense reactions to stress. Autism is relatively common. Current estimates suggest that about 1% of the population is affected worldwide, though rates can vary by region. It is more common in males than females, about 4 times as frequent. However, females are sometimes underdiagnosed, particularly when their symptoms are less obvious or when they learn strategies to mask their difficulties. The course of autism varies greatly. Symptoms usually appear within the first 2 years of life, though some children may develop normally for a while before losing language or social skills they previously had. Early intervention can make a big difference. Some individuals continue to need significant support throughout life, while others gain independence and function well as adults. Even when language skills improve, challenges with social communication often persist. Many factors can influence the development and outcome of autism. Genetics play a major role. Autism tends to run in families, and many genes are involved. It can also be associated with certain genetic conditions like Fragile X syndrome or Rett syndrome. Environmental factors such as advanced parental age or certain prenatal exposures can increase risk. The outlook is generally better for individuals who develop functional language by age 5 and who have higher cognitive abilities. Cultural factors matter too. What is considered a social deficit in one culture might be seen differently in another. Clinicians must consider cultural context when evaluating behaviors. There are also sex-related differences. Males are more often diagnosed, but females might have subtler symptoms or compensate in ways that delay recognition. Autism is linked to an increased risk of suicidal thoughts and behaviors, particularly in adolescents and adults who are aware of their social difficulties. Functional consequences often include challenges in school, work, and social relationships. Many individuals need support with daily living skills. With proper intervention, education, and support, however, people with autism can live fulfilling and meaningful lives. It's important to distinguish autism from other conditions. Intellectual disability, for example, involves overall developmental delays, but autism involves specific social communication deficits that are below the level expected for the individual's general development. Language disorders may look similar but do not involve restricted or repetitive behaviors. ADHD can also involve social challenges, but its main issues are attention and impulse control, not social communication. Reactive attachment disorder and social anxiety disorder can also be mistaken for autism, but differ in their causes and patterns. Autism often occurs alongside other conditions. These include intellectual disability, language disorders, ADHD, anxiety and depression, epilepsy, and sleep problems. Recognizing and addressing these co-occurring conditions is essential to providing the best support. In summary, autism spectrum disorder is a lifelong neurodevelopmental condition that affects how people communicate, interact, and behave. It exists on a spectrum, meaning no two people are exactly the same. Diagnosis is based on persistent social communication challenges, restricted and repetitive behaviors, early onset, and significant effects on daily functioning. Understanding autism requires attention to all aspects of the condition, from diagnostic criteria and severity levels to risk factors, associated features, and co-occurring conditions. With early intervention, personalized support, and inclusive environments, individuals with autism can thrive and reach their full potential. Thank you for joining Lesson 4 of our DSM-5-TR series. In the next lesson, we will explore another major neurodevelopmental disorder and continue building our understanding of mental health.